Hi, my name's Ari Cedars, and I'm the director of the Center for Adults with Congenital Heart Disease at the Johns Hopkins Children's Center. I probably didn't have much of a choice going into medicine. My grandfather and my father and all my aunts and uncles were physicians, and so try as I might to be something other than a physician, I ended up being a physician. But it ended up being one of the best things that could have happened to me in my life. I find it incredibly fulfilling to see patients and to help patients improve their lives day in and day out. Adult congenital heart disease is a relatively new subspecialty of cardiology that was born out of the needs created by the success of pediatric cardiologists and the families of children born with congenital heart disease. Congenital heart disease is actually the most common form of birth defect, with 40,000 children born in the United States yearly with congenital heart disease. As a result of the remarkable heroism of pediatric cardiologists, cardiothoracic surgeons, and the families who care for children with congenital heart disease, greater than 95% of people born with congenital heart disease now survive into adulthood. My research focuses on the ways in which I can quantify patient experiences between hospitalizations and between office visits, such that I can actually measure whether or not I'm improving patients' lives through my care. I think this is a major component of what's been missing in clinical trials that have been conducted in almost all fields of cardiology to date, is that we're missing the bulk of information that's important to patients, that is, their day in and day out experiences. So my research focuses on ways that we can get at that, quantify it, and see if our interventions are helping them. The tools that I have used to this end include patient-reported outcome metrics, as well as a patient-centered healthcare app, which I have developed in concert with patients so that I can almost be in my patient's pocket, walking around with them, experiencing life as they experience it, but then have that data in a quantifiable format so that I can assess after 6 months of walking around in their pocket whether or not what I've been doing has been of any benefit to them. My background actually was as a history major in college, which is probably unusual among physicians. I was led to medicine, as I said, as a result of my contact with my family, all of whom are physicians. I think that the insights I've gained into human interaction as a result of my studies in humanities have served me well in my medical career. My philosophy of patient care is that patients themselves know when they're doing poorly and when they're doing well. And there are things that are outside of what we normally consider to be important as physicians that are important to patients. For example, I find that patients frequently are more concerned about their day in and day out lives, how it feels to walk around and live with their bodies, than it is to say how many times they've been admitted to the hospital in the past year or 2 years. For that reason, my philosophy of patient care is patient-centered. I want to focus on improving the patient's experience, not just based upon a series of laboratory values or metrics that we obtain at the time when I see them in clinic on a regular basis, but more to measure somehow how they're doing at home, if they're exercising, if they're able to do the things that they want to do, if their life is fulfilling to them outside of the medical world.